Hello, welcome. Thank you for being here. In this video, we're going to talk about exactly what this says, running and low back pain. Now, this is a area of research that I find very interesting because it's one that if you aren't familiar with it, you wouldn't necessarily think that there would be a relationship. At least you wouldn't think that there'd be the relationship that I'm going to present to you today. But I think it's also a very helpful body of information to know and to understand because there are relevant implications to other areas of things like exercise, training, musculoskeletal health, and everything of the like. Broadly speaking, the plan for today is as follows right here. So we'll talk about the risk of low back pain from running, at least as can be best inferred from the evidence, the effect of running on pre-existing low back pain. So kind of flipping the script. So if you have low back pain currently and you begin a running program, what happens, and the possible mechanisms through which running may have the effect that will be discussed right here. So in case anyone is interested, these are the references I'm going to use to sort of support all the stuff that I'm going to speak to in this video. To keep these clean, I don't have the references cited here, but in the accompanying article that this video is based off of down below, you will see all of these references hyperlinked next to the claims that they seek to support. So if you want to sort of fact check anything or dive deeper into any sort of topic, I wanted to provide this so that you have that available. So the risk of developing low back pain from running is going to be sort of covered across this entire video, but this was a sort of helpful point to start with in regard to this specific subtopic. So in general, low back pain is super common. Almost everyone will experience it in some way, shape, or form at some point in their life. 65 to 80% are the numbers you'll see across all the sort of prevalence data that's out there. Most low back pain is non-specific in nature, meaning that it is not attributable to any sort of specific pathological piece of anatomy or anything like that. And this is kind of a tangent from the topic at hand, but even with regard to low back pain, if there is pathological anatomy, say a disc problem or something like that, it doesn't always mean pain is going to occur. And similarly, there can be pain occurring with no present pathological anatomy of any kind, like no narrowing of the nerve root exits, no disc bulges of any kind or anything like that. In general, these structural changes do not predict pain or function in people with low back pain. And even someone could have, let's say, a disc bulge MRI and could undergo a sort of treatment plan for the low back, get better in terms of their perception of their disability, their pain, things like that, get re-MRI'd, the disc bulge is still there, but they're still better. So point is that it's the term non-specific low back pain is kind of this sort of umbrella term that characterizes most low back pain because it's confusing, but it's the way it is for most people. So that said, low back pain of some kind, 65 to 80%, depending on the sort of specific study you're looking at. But that's the range you'll see across the general population, which just means everyone. So if you were to somehow analyze the entire population of the United States or the world, whatever country you want to look into, approximately somewhere in this range is the amount of people that at this point in their life are going to experience real low back pain. In runners, it's significantly less. Now, granted, runners are part of everyone, obviously, but if you look at runners specifically, it's somewhere between 0.7, that's probably a bit of a generous number, to 20.2%. So in other words, if we were to sort of randomly pick someone from one of these populations, whether it's just someone randomly from anywhere in the United States versus someone who is identified as having a history of running, person non-runner, let's say, is much more likely to have experienced low back pain at some point in their life or currently or will than the person who is a runner. Now, that said, as I note right here, this does not mean that running will prevent low back pain by any stretch of the imagination. I do not seek to make that claim at all. I do not think it is unreasonable, though, especially when we discuss everything that's going to come after this, to say that running may have a somewhat of a risk reduction effect on low back pain. And really, you can't prevent pain or injury from occurring definitively. I think the term pain-free training or anything like that is much pain-free living, whatever, is much more of a marketing gimmick than anything else. So that said, I don't think it's unreasonable to say that running may reduce your risk of low back pain, but it certainly won't prevent it from ever happening. So now let's flip around, talk about people who, let's say, have low back pain and begin a running program. What happens? So there was a randomized controlled trial published recently called the Asteroid Trial, and researchers love acronyms these days for some reasons. I digress. Nevertheless, they had 40 adults with a history of non-specific chronic low back pain, meaning I believe over 3 months was the time duration in which they've been dealing with the pain. Most people who have like chronic low back pain have been dealing with for a much longer period of time. And again, these are people with non-specific low back pain because sometimes there is a specific pathological piece of anatomy, like it is something that does predict and is the cause of pain That does sometimes happen. So those sorts of people were not included in the study, but the non-specific low back pain people began a run-walk program, meaning they of running, walking, going back and forth, as opposed to just straight running. So it's pretty conservative when you actually look at these sort of training protocols that most people underwent. The sessions were 30 minutes in total duration, and they performed these 3 times per week. And in the actual paper itself, which again is linked in the accompanying article down below, you can see what all these sort of training protocols and regimens actually looks like. They are very conservative in nature, but they were tailored to each individual person. So if someone was more fit or less fit, they sort of accommodated for that. If someone had more pain or less pain, they also tried to accommodate for that. So just to say, like, this wasn't necessarily a cookie cutter run walk program that I can just give to you. There was some individualization. In this specific trial, the asteroid trial, they really performed 3 different types of data analysis. They looked at pain and disability as their sort of primary outcomes. There was another analysis where they looked at intervertebral disc height on MRI, which I will speak to in just a little bit. And then they also looked at the sort of psychological change that occurred in the subjects, meaning what were their beliefs about running, exercise, their backs, their bodies, their health, their resilience, their fragility, that sort of stuff. The study was 12 weeks in duration, and at the end of the 12 weeks, let me just first note that no subject saw any increase in their low back pain. There were a few, I believe 9, what they called adverse effects, and these are just things like transient Achilles tendon pain, something that just doesn't necessarily, go away as fast as you would like. Nothing really serious per se. But in regard to the low back pain specifically, no subject saw any increase in their pain, and all of the subjects saw a statistically significant decrease in their pain. The actual magnitude of pain decreases and decreases in disability varied from subject, as it always will, but all of them did reach statistical significance in regard to how much their pain decreased at the end of the 12 weeks. Now, again, none of their pain was absolutely abolished. They would all still note that there still was some pain at the end of the 12 weeks, but it's worth acknowledging that a chronic pain requires a chronic solution. The study was 12 weeks in duration, and if you've had low back pain for 2 years, you might not get rid of it in 12 weeks. Even if you are doing the thing that you need to do to get rid of it, it's probably going to take longer than that to get rid of the pain. In the same light as, if you imagine someone who is obese, let's say someone is in the 300s with their body weight. They didn't get like that overnight, and so fixing that is not going to happen overnight. So just in general, chronic problems typically require chronic solutions. Whether they would continue to see continual decreases in pain past 12 weeks, you can't say for sure because it wasn't studied. I would venture to say in some way, shape, or form, probably. I don't know if running alone will ever permanently get rid of their low back pain, but if they would continue to see decreases in pain over time, I don't think that's unreasonable to say. So far what we have covered is that people with a history of running, or runners, let's say, have a decreased prevalence and perhaps a decreased risk of lower back pain occurring throughout their life. And people who have low back pain, who begin a run walk program, tend to see decreases in their pain as a result of the run walk program. So when we think of this relationship between running and low back pain, there are 3, as far as I can tell, at least, possible ways that this effect could be occurring. An increase in intervertebral disc height. It could be an effect of pure psychology, or it could just be an effect of just general physical activity increases. So let's run through each one of these individually. So intervertebral disc heights. So what are discs? So you have your spine, and your spine is interspersed by a vertebra, which is the bony part, a disc, which is a sort of gelatinous structure, vertebra, disc, vertebra, strict, and it goes up in intervals in that way. Without these discs, your spine would be one long bone up the trunk of your body, and you wouldn't be able to move your core at all. So these intervertebral discs, intervertebral, vertebra, they're interspersed between the vertebra, the bone. They serve to, 1, allow the spine to move, which is sort of required for living, and 2, they serve as a bit of a shock absorption. So if you were to imagine that you jumped off a box and you landed, if your spine was only bone, that would kind of rattle it a little bit and feel kind of rough. Whereas because there are these sort of shock absorbing discs in between each one, the same way you might imagine on a bike at the front, when you land, it takes some of that shock. It allows us to do so with much more ease. These discs have various compounds within them that attract water to them and hydrate them. The same way that, a sponge soaks up water, a disc can soak up water and become more hydrated. Over time, with age, compounds that absorb this water into the discs tend to decrease in concentration, and as a result, there tends to be decreased water and less hydration to the disc. What this can do is cause the disc to shrink in height. And what this can do basically is make the disc not as able to facilitate the functions that I just mentioned. So not as able to absorb a shock and not as able to facilitate range of motion throughout the spine. Oftentimes when you hear people say that they get shorter with age, this is why. There are a number of studies where they take people with a history of running and they do an MRI on their spine. And they compare those to MRIs of people who do not have a history of running. And the people with a history of running who are middle-aged or older tend to have greater intervertebral disc height, indicating greater hydration and healthier discs than those who do not have a history of running. And that makes sense if you think about what I just told you. Running involves a lot of shock. Every time you take a step, your body has to absorb shock, and part of the way it has to adapt is to learn to deal with that shock. The discs serve to help with shock absorption in the spine, which is exactly what you need in running. Now, like I said before, in the asteroid trial, where they had people with low back pain perform a run walk program, they performed this analysis. They did an MRI on them and looked at their intervertebral disc height before and after the study. And in this study, they did not see any change in intervertebral disc height after the 12 weeks. And in my opinion, there are really two conclusions that we can draw off of this. So one, it's either that 12 weeks isn't enough to really see the adaptation to the disc from running, or two, it could be the case that running doesn't lead to increases in intervertebral disc height. It just slows the regression of disc height with age. Both of those are objectively good things. I just don't think we can really say for sure which one of those is correct. If the latter is correct, in the sense that running just only serves to slow down the age-related regression of disc height, and you took these people with low back pain who began a run walk program and you viewed them over time, I think it would be fair to say that you might see a slower regression of their disc height. But again, all in all, it seems that running is healthy for disc height the same way that you do a bicep curl, your biceps get bigger, you run, your discs get healthier. It's just what specific shape that health promoting effect takes place, I don't think can really be said for certain. So like I said before, the asteroid trial, and I'm referencing this one a lot because this is a really well done paper, one of the first sort of interventional trials looking at running low back pain. But like I said, they looked at the pain and disability changes in these people. They looked at their intervertebral disc height, as well as they performed a qualitative assessment of the subject's fears and beliefs regarding running exercise and the fragility or resilience of their body overall. And if you look at the actual paper, you can see a lot of the actual quotes that the subject said before and after the 12 weeks were performed. I try to sum it up nicely here in the sense that they saw things like running, even weightlifting, some of them talked about, going from dangerous to safe, and they saw themselves go from, broadly speaking, damaged to resilient and adaptable. And this is really important, in my opinion, because the psychological outlook of pain can oftentimes be the thing that turns pain from acute to chronic pain more than anything else, I would say. So, for instance, if you look at fear avoidance behaviors, and fear avoidance means you fear movement because you are afraid that the movement will hurt you and cause you pain or regress your situation. There's a study where they had people perform deadlifts, and some of these subjects believed that deadlifts were bad for their back, and some of the subjects believed that deadlifts were good for their back. And the results in regard to how their backs responded afterward were exactly what you think I'm going to say here, in the sense that the subjects who thought deadlifts were bad for the back were more likely to experience back pain from the deadlifts, and the subjects who thought deadlifts were good for their back were more likely to see, or rather less likely, I should say, to see back pain from the deadlifts, which, by the way, risk of injury from things like deadlifting is abysmally low, something like 1 to 4 injuries per 1,000 hours of participation. Basketball, just for reference, is somewhere between 8 to 50 injuries per 1,000 hours, depending on practice, game, competitive, recreational, etc. So just to put that out there. And this is something of what you might call a nocebo effect. So everyone knows of the placebo effect, meaning if I take this pill and I think the pill is going to have this effect, it's therefore more likely to have that effect than if I didn't think it was going to have that effect. The nocebo effect means that if you think something is going to harm you, it therefore becomes more likely to harm you. So I think you can, start to see that if you see exercise as generally safe, which all of the evidence suggests that it is, and you see yourself as resilient and adaptable, the outlook of any given musculoskeletal condition, as well as the risk of any musculoskeletal condition occurring, is significantly better. Another thought is in regard to nervous system sensitization, or failure to desensitize is really what it should be. And that's why I put desensitization right there. So when you experience an injury, say you sprain your ankle, your nervous system sensitizes, it turns on to send the signal to your brain to say, hey, something's up at the ankle. Let's cause pain here to restrict the person, you, from using the ankle so that we can get it to heal. Something that is talked about in chronic pain research is this failure to desensitize, meaning that when an injury resolves, heals, goes away, the nervous system should desensitize, stop sending that signal to the brain to say, like, hey, it's fine now. We can use the ankle. It's all good. Sometimes, though, the nervous system seems to fail to desensitize, meaning you have an injury, the injury heals and resolves, but the nervous system still thinks there's an injury and it's telling you, your brain, that there is an injury and the pain persists. And that is almost a bit more physiological than psychological, but the psychology does significantly influence the physiology. So now I'm not speaking with any confidence here to say that this effect is definitely occurring, but there is the school of thought out there that if this sort of change in your beliefs and your worldview on yourself and exercise changes, then your nervous system's ability to desensitize may be enhanced. And given that in the asteroid trial, the subjects didn't see any changes in intervertebral disc height, that very well could be what happened over the course of the 12 weeks, because that is something that would happen on a shorter time scale than changes in disc height. And lastly, I think it's worth adding that the meaning that you attribute to your pain greatly influences how painful the pain is overall. In other words, if you experience an episode of pain, which almost everyone will at some point in their life, and you see that as transient, as normal, as okay, as the world's not ending, you're going to have a much better experience in terms of how that pain affects your life and how quickly the pain resolves than someone who sees the pain as meaning their body is breaking down, meaning a ton of damage has occurred, et cetera, et cetera, et cetera. And now let me also just add right here, in terms of, this psychological influence right here, this does not have to be from running specifically. This could happen from any form of increase in physical activity that produces these psychological changes in your beliefs and your outlooks and your fears and all that sort of stuff. I think running is great, but it doesn't have to be from running, just to put that out there. And then lastly, the third reason why these subjects may have seen decreases in pain over the 12 weeks could just be from just getting more active generally. And that speaks to what I just said about that this doesn't necessarily have to be from running specifically. It could just be from getting more active and these sort of belief changes occurring. So, like I say here, everyone knows that if you sit all day and you don't exercise and all this stuff, that your risk of heart disease, of diabetes, of almost any chronic disease increases substantially. The same is true for low back pain. On average, people who are sedentary tend to have greater rates of low back pain than people who are physically active, no matter how that physical activity is defined. So really, the main point that I want to add here is up here. You shouldn't view sedentary behavior as just a risk factor for your more common chronic diseases. Cancer, I would say, is probably included in that as well. You should view it as a risk factor for joint pain, for musculoskeletal pain of any kind. So wanted to give you some couple take homes here just to finish this video off. So if you are currently experiencing low back pain, running is more likely than not to improve your situation and reduce your pain. And at the very least, it's unlikely to worsen low back pain. There doesn't seem to be any evidence to suggest that would occur. Again, running may have a protective effect on your back and your spine in the sense of either limiting the natural age-related decline in intervertebral disc height, or by potentially increasing it over a longer period of time, but can't really say for sure which one of those would occur. And lastly, probably most important, is that human bodies are much more adaptable and resilient than people tend to give them credit for. We're not fragile. We're not made of glass. The term wear and tear should just be thrown out the window and never thought about again. Now, with all this stuff, proper programming, proper dosing, doing the right amount at the right time is a consideration. With any form of exercise, there is an amount small enough to where you would see no effect, an amount too large to where risk of injury becomes there, and then an amount that is appropriate that is going to allow you to recover and adapt and make you better and healthier over time. So that goes without saying. But in general, you are not fragile and you can handle more than you may have been led to believe in the past. So this is where I'm going to end this video, and I hope you found that somewhat helpful or interesting or somewhere in between. Any questions, comment below, and I'll get back to you as soon as I possibly can. And I hope you have a great day, and I'll talk to you soon.